Hello, everyone, and welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're talking about myocardial infarction, also known as a heart attack. What actually happens when the heart's blood supply is cut off? That's exactly what we're going to break down. We'll cover what a heart attack is, its causes and risk factors, symptoms and key types, how it's diagnosed, and finally, intervention and management. Let's dive right in. So, what is a heart attack? At its core, a heart attack occurs when there is an imbalance between the oxygen the heart muscle needs to function and the oxygen it is actually receiving. And this is typically caused by a loss of blood flow. What causes that loss of blood flow? It usually comes down to a plaque buildup inside one of the major arteries supplying the heart muscle. When the plaque ruptures, a blood clot forms, and that clot blocks blood flow to the heart. Without blood, the heart muscle cells begin to die from a lack of oxygen, a process known as necrosis or cell death. Now let's look at the causes and risk factors. The primary cause of a heart attack is coronary artery disease. That same plaque buildup we just discussed, which leads to clot formation and reduce or completely blocked blood flow to the heart. Other risk factors include hypertension, smoking, alcohol use, high lipid level, physical inactivity, diabetes, and chronic stress. Moving on to types and symptoms. What might a patient present with that points to a heart attack? The most well-known symptom is chest pain, which can relate to jaw, neck, shoulders, or arms. Other symptoms include nausea, shortness of breath, diaphoresis, which is excessive sweating, and a feeling of faintness. It is also worth noting that a heart attack can occur with or without symptoms. Some patients will present with all of the above, while others will have no symptoms at all. There are two main types of myocardial infarction, a STEMI and a non-STEMI. So the STEMI is spelled STEMI, and a non-STEMI just starts with the N in front and STEMI. On a normal ECG tracing, there is a segment called the ST segment. In a STEMI, the ST segment is elevated. In a non-STEMI, it is not. A STEMI typically involves a complete blockage of the coronary artery and requires immediate intervention. A non-STEMI, while still serious, usually involves only a partial blockage. So, how is a heart attack diagnosed? It starts with a physical exam, reviewing a patient's history, identifying risk factors such as hypertension or diabetes, and assessing presenting symptoms like chest pain, nausea, or shortness of breath. From there, we obtain an ECG. On the ECG, we may see an elevated ST segment, which points to a STEMI and signals ischemia, that cell injury and oxygen deprivation we discussed. We may also see inverted T waves, which indicate myocardial injury, and Q waves, which may develop in cases of prolonged ischemia and necrosis. We'll also look at lab work and biochemical markers. Troponin is one of the key markers. It is released into the bloodstream when heart cells begin to die. CKMB is another marker that becomes elevated for the same reason. Both are important indicators that cell death is occurring. Now let's talk about intervention and management. Several medications are commonly used in treating an MI. Beta blockers, such as metoprolol, work by reducing the heart's oxygen demand through controlling the heart rate. Nitrates, such as nitroglycerin, improve blood flow by relaxing the smooth muscle of the arterial walls, allowing more blood to pass through. Antiplatelets, such as aspirin, help prevent further clot formation. And pain relievers like morphine not only manage pain but also help relieve the sense of breathlessness that often accompanies an MI. From a nursing standpoint, key intervention include monitoring vital signs, reviewing lab results, obtaining and interpreting the ECG, and administering medications as ordered. Patient education is also a critical part of nursing care. If a patient smokes or drinks, we need to clearly explain how those habits increase their risk and support them in making lifestyle changes, whether that's engaging in physical activity, eating a heart healthy diet, or managing stress. These conversations matter. And on that note, I'll leave you with a small question to think about. What one small change can you make today for a healthier heart? That brings us to the end of this video. I hope you found it helpful. If you did, please like and subscribe, and I will see you in the next one. Thank you.